So it's just been tremendous, the dedication and the commitment to that those public providers have to ensure that people who experience a mental illness, a substance use disorder, have the support and access to services. They really have gone above and beyond. Most of the services, have fared okay, and as Randy talked about, the COVID-19 funding and compensation, which I think has been very needed and appreciated by providers. I always have looked at it as it's a way to ensure that they're viable when we gear back up for 100% utilization and so forth. Our residential providers, because of the guidelines and the COVID, the directed health measures and that, they cut their capacity in about half, because many of the residential programs, they have dual occupancy rooms, and so they took those down to single occupancy. So that cut our capacity really in half for a lot of services, and it just extended the wait list for some individuals, but I think most of our residential services in the last couple of weeks have geared back up to their 100% capacity. So obviously that impacted their revenue, and so that's really why the COVID-19 funding was really important. Some of the other challenges we've had, and I had an opportunity to talk to many of you around what we call the overproduced units, just the increase in demand for services, behavioral health services that was experienced across the state. And actually 4 out of the 6 regions experienced that in a fairly significant manner, and we were one of those.